Hello, everybody. I hope everyone's having a good week. We're coming into a long weekend here in the U.S., and I think it's going to be nice to have a little bit of a break and some time off. I wanted to talk to you today about something that's been coming up quite a bit with a therapist that I talk to, and that is the role of fear and self-doubt in your growth as a clinician. We often don't think about it that way, but it can be a very powerful way to analyze how you're feeling about a case, dig a little bit deeper, and see exactly what you need to do to either move on with this case or make a referral to somebody else. So let's think for a minute. You're in a session with a client, and it might even be your ideal client, and you are having some self-doubt, and you're finding yourself thinking, can I even help this client? Do I even know what they need? It's possible that you're being triggered in some way that you're not aware of. It's possible that getting a little bit of consultation with another clinician and talking through what the conversation was and how you were reacting and how you were feeling that in your body would allow you to be able to resolve that issue, or at least acknowledge and hold space for that issue and move forward with the case. There are also times when you might be working with somebody that's either a newer population for you, or you're using a new treatment modality or theoretical orientation, and you have fear popping up. Fear can be really powerful, as we all know. But I have learned that I need to challenge myself to look at fear as a possibility for growth. When I'm feeling fear, it often means that I'm just on the edge of knowing what I need to do. I can get the consultation or do some research or do the things that I need to do to make sure that I'm providing the best clinical work I can for that client. And what happens is, as I notice the fear dissipating, I realize that I've sort of reached a new plateau with whatever the issue was that I was dealing with. And that's a really remarkable feeling. So I just want you to remember, the next time you are feeling self-doubt or fear, stop and question it. Talk to some other clinicians, talk to some colleagues, get some consultation. Think about what you're doing in this case that's different than other cases that may be triggering some of these feelings for you. And then check back in and see what the outcome was. It might be that you determine this is not the right client for you and they would be much better served by another clinician. And in that case, you can refer them out. But you might just find that you've developed a new level of confidence, and that the process that you're going through with this case can be great for both you and the client. So just keep that in mind when you're feeling fear or self-doubt in your clinical work. Heck, actually, you apply that to everyday life as well, right? Okay, thanks for joining and have a great day.